Welcome, Dr. Lenz on the me&my Health Up podcast show. How are you today?
Doing great. Thanks for having me.
So great to have you on the show. It's really good to have physicians on the show, and we share a bit of commonality, and that's our surname. It's a German surname, so that's good.
Yep. Well, thanks for having me. It's a pleasure to be able to talk halfway around the world. And,
awesome. Dr. Lenz, let's start with how you've arrived at what you're doing today.
So I, as far as interest in fibromyalgia, I do pediatrics, internal medicine, lifestyle medicine, cholesterol management, but my specific interest talking about today in fibromyalgia was started because it was a mystery kind of problem, and I know that was leaving a lot of people frustrated. I heard of the word maybe around 1988, 99, 2000. Never had any training on it, just on my own research, looking things up, and wasn't getting a lot of, there's so much you have to learn in residency, and started recognizing that there were other problems going on like migraines, IBS, recognizing there's a familial connection to things. And probably in the last 11, 12 years, started recognizing through more information, people like Dr. Daniel Claw, who's done a lot of research at the University of Michigan in the United States on fibromyalgia, and recognizing how this is a central pain processing problem, and started incorporating that in my patients, starting to learn more, and probably in the last 4 or 5 years, started seeing some other connections, recognizing the role lifestyle has. And I started with probably 6, 7 years ago, a 2-page handout, which when you have a very complex problem that involves so many different aspects of medical and lifestyle management, it's very hard to get that out in a visit. So I extended it to a 20-page handout that I would print out on our medical records computer system. And then I thought that's still not enough. And then I decided to get interested in writing a book probably 3 or 4 years ago, and then accelerated that with the publication of that about 1.5 years ago. And the goal was really, primarily, my first thought was if I could give this to my patient and also to their loved one, to their spouse, their friend, their family, who really just doesn't understand this mysterious problem that they have that's so frustrating, and also wanted it at a high enough level that other medical doctors can pick it up and have it not just at a 6th grade science level, but get into a pretty in-depth understanding of a lot of the biochemistry and discussing the studies and how our brain works. Because I feel that a lot of people with fibromyalgia are extremely intelligent, and they deserve more than just a superficial elementary discussion, but trying to give as much evidence and discussion for that. So that's a quick overview. Kind of just a heart. One of my favorite group of people that I get a chance to take care of are people who have fibromyalgia, because by the time they have seen me, most of them have had years, if not decades, of frustrated care, often dismissed by the medical system, and felt that they were just imagining their pain and that it wasn't actually real.
Yeah, because the process of getting diagnosis can be lengthy, because the medical fraternities ruling out any other, conditions before it really gets to this. It's it's a bit like, do you categorize it a bit like IBS? It's sort of that default when they can't really classify it as some other condition, or yeah.
It's because both of them are, we call them central pain, which means central nervous system processing problems within the brain, brainstem, spinal cord, and affecting how the brain and how you experience pain. And I think of fibromyalgia as the overview of that, and then under that are regional central pain syndromes, including things like migraines, tension headaches, painful periods, abdominal pain, cyclical vomiting, even painful intercourse for women, all falls under that category. And in one sense, it's not very hard. I would say it's like making a diagnosis of a migraine headache or an irritable bowel syndrome. I can make a very good history if you come in and you tell me I've had let's say you said I've for 15 years have had these episodic headaches that can last from a few hours to 2 or 3 days that are severe and pounding. I get light sound sensitivity and I need to lay in a dark room, ice pack, and lay down. I can pretty much say you do not have a brain tumor, because brain tumors do not come and go. And if you had one, or if you had a bleed or a stroke, and you're relatively normal in between. So in a similar way, if we know what we're looking for, and there's now accepted criteria for diagnosing this, has been around for several years now. We use a history, so a careful clinical history, right? If somebody comes in and says, I've had chronic diffuse, or often it starts as painful, a classic story is a woman who had some stomach pain, maybe in elementary school, when she started menstruating regularly, develops painful periods, much more painful than their friends, almost where they have to miss school for a couple days. It gets so bad. Then they might start getting migraines, tension headaches, and then maybe there's an accident, injury, or something happens where they start hurting all over their body. But even if somebody has fibromyalgia, and I have an episode on my podcast where I talk how history is so important. But if they suddenly say, now I've got bloody stools and I've lost 15 pounds, I have to go, well, maybe this person has also developed colon cancer, ulcerative colitis. You can have other things going on. So you always have to be careful and listening. Just like somebody who has a panic attack could end up having pulmonary embolism or blood clots in their lungs. So you always have to be careful. But you can then take what we call the widespread pain index, so WPI for short, and the symptom severity score in addition to a careful history. And then it's basic common labs that aren't fancy. You don't have to spend a lot of money, checking your thyroid, CBC, comprehensive metabolic panel, looking at liver, kidney function, glucose levels, and also usually a sedimentation rate. And then a careful exam. We usually are inspecting joints for swelling and other problems. Although in the past they said, if you have rheumatoid arthritis, you can't have fibro. So now that actually is incorrect. You can have other problems in addition to fibro. In other words, you can have rheumatoid arthritis and you can have fibro. In fact, about 40% of people who have rheumatoid arthritis also have fibromyalgia. So it's part of that. And then, so you use that. And most doctors, I did on a Facebook group, I asked, do you even know what this is? These were people who with fibro, and they've never heard of it. The doctors are not regularly using this because the doctors were never trained on this. When they were in training, it often, the saying is that every 7 years, half of what you learn changes. And it takes about 17 years for something that is commonly accepted in practice. Like this was in 2016 criteria. Most doctors have not implemented that, because you have to be interested in this. This is kind of a problem where you just have to either have a heart or know somebody or just pick up a passion to want to learn this. So getting back to, I really like helping people with this because it's very frustrating. But when you have somebody that is the most frustrated and you can help them and reduce their symptoms and even reverse them through a comprehensive approach, that's just the best. Nobody, I kind of joke, nobody gets excited and say, Dr. Lenz, I've had a urinary tract infection for the last 7 years. I've been to 15 different doctors. You're the first person to diagnose it. Nobody says that because that's common. That's a common, easy one, to fix. And in medicine, we kind of like easy ones. People who go into emergency medicine, like saving the person who had the heart attack and rescuing people and fixing broken bones. But these are somebody who wants to spend time getting to know people, getting to know their backgrounds, talking about lifestyle. The role of lifestyle has a strong effect. Kind of an interesting, and I don't maybe get to it later, but one of the surprising things is of many, and probably the vast majority of people who have fibromyalgia actually were extremely active when they were younger. Whether or not they were actually an athlete may or not be the case, but they might have just been at a time, if they're my age, they just played after school because there weren't the video games, and they just played with their friends and rode bikes and whatever. The kids in the neighborhood, they were just playing for hours after school, and they were getting their exercise. Or they might have actually been high-level athletes when they were younger. and then something happens. They blow out their ACL, they get neck pain, or they graduate from their sport, whatever level they get to, whether it's high school, college, even professional, and then they start developing the symptoms later. But by the time the doctor sees them, they don't even the fathom that this person who's at such a low level of activity and high level of suffering ever was very active would be shocking. But by just bringing that up, it validates, like, hey, I know that you have a memory of what it's like to be living a different life. And I often say, if you went in a time machine, I like movies with time machines, if you could go back in time and say, hey, in 25 years, you're going to be living in a severe fibro, most would just never believe it. And often that's the frustrating, how did I get here? So.
And that's unknown, right? It's essentially, we don't, I mean, there's some genetics that are at play here, some, other areas, I guess other disease areas that could have been, a causative factor, but it's really unknown, right?
Well, actually, my opinion is that we understand it, but the problem is it's a multiple factors that play a role. And I just did a podcast on the author of Gone with the Wind, a famous world epic novel. The woman who wrote the book, Margaret Mitchell, born in the year 1900, had both fibromyalgia and ADHD. Just understanding how we understand pain and how we understand disease. Back then, it was just infection in the year 1922. And surgical managements. The idea that we couldn't even look into the brain. Now, with our understanding using functional MRIs that look at blood flow to the brain, we can recognize that people who have fibromyalgia experience pain at the same level as others, looking at as the same parts of the brain are activated to the same levels, but it's for stimuli that are that should not cause pain. They do studies where they'll apply pressure to the thumb. And if you don't, and I don't have fibro, we might have to have 4 kilograms of pressure on our thumb to have pain, where the person with fibro reports the same level of pain, but only at 2 kilograms. They've done that with studies where they'll have a very quiet room and they'll gradually increase the decibels. And then you say, just tell me when it's moderately uncomfortable. The person with fibromyalgia reports that at a lower threshold. They've done this in looking at in the irritable bowel spectrum, put a balloon with a pressure sensor in there and inflate the balloon. And then tell me when it's moderately painful. People with fibromyalgia will report pain at a lower threshold. Years ago, before we did colonoscopies routinely, I do flexible sigmoidoscopies, which are only going up half of the way, and we didn't need anesthesia. Well, we said we didn't need anesthesia. We did it without any. And I remember there were patients who would just like spasm and they'd get tight and it would be painful, and other people just flew right through. So what we now know is actually it's how our nervous system responds. It's that nervous system being hypersensitive. And then we know that is connected with other coexisting conditions. There's other conditions like RLS and ADHD that play a role and make us more prone. There are lower levels of likely neurotransmitters like norepinephrine and dopamine that are lower that affect it. So there's heightened pain sensitivity, and also there's often deficiency in what we call the descending pain pathway within the brain and the central nervous system that affect it. And then there's a lot of inputs. The comparison is like having a guitar hooked up to an amplifier. And this volume coming from the guitar represents the amount of pain somebody experiences or discomfort, because it might be light, sound sensitivity, smells. Similar if you know somebody who's had a migraine headache, if you're around them and you're kind, you can tell you just turn off the TV, put on your headphones, turn off the lights, and you guys go, hey, guys, let's go outside. They're not feeling good if they're laying on the couch, and you let them rest because they're hypersensitive. You and I could sit there and be not bothered at all. When I have people come into my exam room who have fibromyalgia, I can tell just by looking at them, just almost like a severe migraine, where they might have sunglasses on, and I have some windows with shades on one side of my room, and I'll just turn off the lights. I'll say, is it all right if I turn off the lights? They're like, no, I'm fine. I'm like, let me just turn off the lights and they just, I feel better. They take off the sunglasses. You can just feel the weight come off their shoulders, but it's also being empathetic to recognize that I like having it bright. as I'm getting older so I can see better with these nice bright lights in my exam room. But for somebody struggling with fibromyalgia, those lights would be extremely uncomfortable. Noise, light, sounds. And so getting back to that amplifier concept with the guitar connected, is that some people, their amplifier is set higher. It's like a genetic preset. Well, then we look at what are factors that can turn down the volume. Getting the good sleep, consistent exercise, eating a healthy diet, having the stress at a good level. You can't control your genes, but if you do have a coexisting condition like restless leg or sleep apnea or ADHD, recognizing that and then treating that actually can make a difference to help reduce the suffering. But all of those are working in concert. And it's a different thing when you're dealing with lifestyle to treat medical problems, right? It's not just giving insulin or taking a thyroid pill. It's a very active, engaged problem. It's not a passive problem disorder where the doctor does this and it works. You have to be engaged, and it's a different concept. So that's why I wrote the book as well, to get a deeper understanding, to recognize, okay, and do it with the podcast, to continue to have those conversations, though, that people can have some agency, that sense of self-control to whatever they can. And also because recognizing how educating their loved ones that no, when they say the TV's too loud and it's too bright in here, they're not making that up, and support them. Yet at the same time, it might be, hey, well, can you help support them, eating a healthy, more plant-based diet, keeping on a regular schedule, help encourage them, but not annoy or harass them to try to get on a regular exercise regimen, and getting that attention and being supportive, because it's very challenging, very challenging.
So have they identified the gene that can give these people a genetic predisposition to the condition?
There's not one gene. There's multiple genes that are likely involved. And a lot of these that they are identifying are often affecting levels of dopamine, norepinephrine, serotonin levels. And there's probably multiple areas that are affected. There isn't just one magic gene. Even in the world of high cholesterol, hypercholesterolemia, we used to think, the concept is one gene's broken. Now there's probably 70, 80 genes that are involved in this, and there's probably slight variations that affect different levels to different degrees. So there isn't just that one magic, and we don't do any routine testing to measure any of these levels. These are just done in research and very special tests that involve radioactive, or I don't know if it's radioactive, special isotopes that take a lot of time and money to do on these scans to show different levels of this. That I love reading about the research, but it's not something you use in a practice. It's just to validate that, there are these issues that they do play a role. And that's often why, because genetics do play a role. It's roughly about a 50-ish% inheritance. I think what we know, just like lifestyle issues, diabetes is often in that genetic 50-50 inheritance, type 2 diabetes. But whether that passes through can be, is the saying, as you've probably heard, genetics can load the gun and your lifestyle pulls the trigger. So a lot of times if you're able to say ahead of time, and I actually, because I'm a pediatrician and an internist, so I see kids and adults, I have 3 generations of people who I take care of. And often when I see somebody who may be in their 30s with a child who's maybe already having some struggles, identifying, because I treat, for example, ADHD, if that's something they have, that be recognizing, okay, that's something we got to look at. If medication, it can be very helpful, but also recognizing that, hey, this child throughout their life, and if mom can role model this as well, or dad, that exercise is what we do. And I heard on one of your podcasts, as you probably said many times, I don't like calling exercise, I like to call it movement. I call it exercise, I call it having fun. You can go for a walk, swim, whatever you want to call it. But hey, we are wired. I use this analogy, and I have a sense of humor. So when I use this, I'm not calling people dogs. But as you know, there's a bell curve. And I don't know how many people in Australia do you think have dogs that, is that... It seems like half the people in my neighborhood have it.
We had a dog boom during COVID.
Okay,
there was certainly a dog explosion. There was a dog shortage.
So we have we are such busy with our life, and our one daughter really wanted a dog for a year, and we just don't have the lifestyle to pull the trigger to attend to a dog and give appropriate care. But we see all different types of breeds of dogs, and there's one dog that one of our friends has who has the look that if you walk the dog around the block, it would be like, oh my gosh, that's so far, a whole block. And I know there's other breeds, if you went for a 4 or 5 mile run in the morning before work, they say, okay, so who's going to run me after work? That was a good one. I'm ready for another one. Let's do another one. And they just are wired to have to run. And so just if you embrace that, and that's why that college or that former very active level, and women maybe would have been dancers, might not have been the formal athlete, but hey, you're wired. I've had a lot of patients unknowingly say to me, if they're on that, I kind of a little bit of that fibromyalgia predisposition, Doc, if I don't exercise vigorously 90 minutes a day, my mental health isn't good. And they've had that self-awareness. I'm bridging like, hey, that's like taking medication. And that's what your body's wired to do. Other people who aren't prone to fibromyalgia, they could go to a lifestyle conference for a week and listen to, the best speakers in the world 8 hours a day and then hang out and socialize, and they wouldn't feel pain. Where there's other people who, if they don't get their, at least 10,000 steps a day, they start hurting. And that's just how they're wired. So that recognition, right, that this is how you are. And so if you can recognize throughout your whole life, it's going to be really important. And also recognize, yes, there's some people who can eat really bad food that's really low in fiber and high in processed carbs and fat and salt, and they don't get any irritable bowel. They don't get migraines. But if you're prone to this, you don't have that. So it's just, and actually you feel better. Why would you want to? And there are some people who are prone to asthma, right? And other people aren't. If you are, don't smoke cigarettes. And there are other people who might smoke cigarettes and they don't have an asthma flare. You never should smoke cigarettes. But it's just like, if you're prone, well, you just have to have that awareness. And often when I talk to people about this, they'll say, I wish you were my pediatrician when I was 8 years old, because they started saying that they thought I was coming in with chronic abdominal pain and with going to the school nurse faking it, that I was just trying to get out of class. And now when I see those kids, it's like, hey, one interesting example, because it's on these regional pains and talking about lifestyle, I had a patient who was filling in, seeing for the partner I work with, and he had stomach pains. Well, they were triggered because he stopped exercising, and I live in a cold part of the world, and he was playing basketball. And then after Christmas, there was a gap for 2 months, and he stopped exercising, and it was too cold. He wasn't going outside, probably on video games, and he wasn't as active. And then he started getting these, what we call abdominal migraines, bad stomach pain with nausea. They were episodic, and nothing else changed except he stopped exercising. And kids are wired. But if he would have taken to the local YMCA and said, hey, you need this. And that's why a lot of kids in my part of the world, in the summer, they don't get stomach pain and headaches. And then school starts, and if they're not in a sport or it gets cold out and they don't, compensate and go to the gym, they start getting more pain. And they also have more stress because of more schoolwork, which might squeeze out exercise. And all of these are feeding back and forth. If you're trying to get a lot of exercise, but you're not sleeping well, or you have a lot of work demands that maybe if you have untreated ADHD, you're not as efficient in getting done, then you feel guilty about getting that 2-hour workout in, which you needed before, which you got when you were in college, but now it's hard. And then you're stressed, and now you're eating, tempted to eat junk food, which temporarily makes you good, just like having a shot of liquor makes you temporarily relax, but isn't a long-term solution. And you see how these all are interconnected, and it's like a perfect machine, and then it starts to get out of rhythm, and you can start having problems. So that's explaining how complex, but to me, I'm a faith person, and I look at it and say, wow, how incredibly designed we are, but you just take one thing and you shift it off, and it starts to not work efficiently. And you start getting all these problems. And So to say, yeah, I do think we have a really good understanding of it, but it's a different concept and understanding. This 100 years ago, it's just simple. Oh, you have a bacteria. Find the bacteria, right? find the malaria, there's a podcast called that it talks about the history of medicine, and I love it's by a doctor, and it's pretty nerdy. I love going back and wondering, well, what it was like. Well, how did we figure out what malaria was? How did the first people? Well, they didn't know. The whole story of the four humors, like melancholy and all that, the bile, and George Washington, our president, got bled to death because they thought, well, let's take off some steam. He's got too much blood, But we laugh, but the poor people with fibromyalgia who are struggling aren't getting that information because it's a lot more complex, right? It's a lot more complex than just some simple A equals B.
And is that why you think it's getting missed and often late diagnosed, or people carrying the condition for many years because physicians just don't have the time with the client? In Australia, well, certainly I can't talk about the States, but your physicians typically have a 15-minute consult and they hear all the symptoms. That they don't get a lot of time with their patients, and they generally get
that is a barrier, and that's actually again part of why I wrote the book. And with that, because I actually end up often get behind because I'll take time. I get a 30-minute visit for a patient. Love to get 45 minutes. I always love, if you want to see me, try to say, can I have the last patient of the day? Because then I had somebody that was new to me who came 6.5-hour drive because she went, after years of seeing different doctors, she finally got diagnosed by a rheumatologist who often makes the diagnosis, and it's the second most common diagnosis in rheumatologists, but most of them do not treat it because it's a brain and how your brain processes it. They're used to real problems in their mind. That's the real inflammatory problems of lupus and rheumatoid and those kind of things. So they'd say, okay, you have this. Now go talk to your primary. And she's like, well, my primary didn't know what to do with me, and now you're telling me to go back to them, and they didn't know in the first place, so I don't have a lot of confidence. And then they call around to other primary offices and say, do you treat fibro? Nobody treats fibro. I kind of compare it to Jesus and Pontius Pilate. Go to King Herod, and Herod doesn't know what to do, and it comes back to Pontius Pilate, and he's like, what am I going to do with you, right? And then get this uncomfortable feeling. And I think it's like put the head down and mumble a couple things and just hope you go away. And then often what happens is the doctor doesn't know what to do. So what can a doctor do in a short visit? Well, we'll order another thyroid test and a CBC and another test, and then but doc, and I have my second episode that I have, I think on my podcast, I think it's the second or one of the first ones, it's called, It's Not My Thyroid. Because all of these patients, every time they go to a doctor, they're like, well, let's check your thyroid. No. You're not getting away that easy. I've had this. I've had it checked 4 times in a year. It's not my thyroid. I know it sounds like it could be my thyroid. I know if you look at the textbook, and actually sometimes what happens is they got shuffled. And in America, and I don't know how much alternative medicine within the government system is, then there will be people who go, well, no, it is your thyroid, but we didn't do the right test. We got to do this really special, expensive test, and then they go on all of this, and then they end up going for years of this. Or in America, there's something called Lyme disease. I saw 2 people with Lyme disease. If you look in Wisconsin, it's known as, there's a lot. It's summer, people are going outside. I had 2 people with Lyme disease 2 weeks ago. They had classic Lyme disease. Actually, I had a third person who was in urgent care who I talked to who had it today. But then there's people who have chronic, really, fibromyalgia, and there are, quote, Lyme literate doctors who will say, oh, well, your chronic, really, fibromyalgia pain is actually Lyme. And we have to do a special test that your regular doctor didn't have. The infectious disease doctors dismiss that. And if they go, I want to see the infectious disease doctor for my chronic Lyme, they don't even see him. They just dismiss him, which doesn't help. So then they get shifted into this other world, and then they get taken advantage. A patient of mine had a shopping bag full of supplements, and she was having an upset stomach, taking, literally handfuls every morning of this and doing all these special tests. And I'm like, you don't have this. And she was getting suspicious. And the reason I met her was because I was seeing a friend of hers mom who was in for a visit, and something mentioned fibro. I don't even know how it come. I think, oh, who is that? Oh, my friend. She's had this, and she's looking for a new doctor, and she was very frustrated. And then I saw her. I squeezed her in my schedule. But the person who came 6 hours away, I spent like 4 hours with her because I felt terrible. I'm like, all right, I normally say come back in 2 weeks, and so I tried to get as much information. She had read the book, and she actually said she found me because her one doc said, well, maybe you'll find somebody on the internet. Maybe you'll learn something. But good luck. And that's how she found me. She emailed me, listened to the podcast, and she read the book. And in the book, in the first 4 chapters, she said I was crying because you talk about this, and that was my life. And part of, as a lot of people say, well, do you have fibro? I'm like, no, I don't have fibromyalgia. I occasionally, if I'm not perfectly getting good sleep, up excited for staying up late for a football game or traveling and bad schedule, I might get a headache. But I don't have this. But I just care about people. So I just want people to get better and help in some way. So normally I could say have people come back in a couple of weeks and see them back. So spend time with them. But you're right. That having that limited time with patients, and part of it is, I think often when they might go to the doctor and they list all the symptoms, doctor's like, oh my gosh. And they often must think, well, this is the crazy patient. She always keeps telling me, we'll just order some more tests just to humor you. And the patient actually isn't not wanting more tests. They just want an explanation. And sometimes when they do get more tests from maybe an alternative medicine doctor, and they go, oh, we found it. But then you have questionable motives. Like, here's a special supplement. Here's a special thing to take. And then here's a special test that shows this genetic thing that you have. And it's really not evidence-based, And then I'm going with hope, maybe a slight short-term placebo effect. And part of that is that caregiver effect of just somebody who's caring. But that's part of my hope with the podcast and with the book, too, is that this you can take to the doctor, and what ends up happening is a patient themselves has to be an advocate for themselves, but they have to have somebody standing in their corner. And I did a blog on my website, Conquering Your Fibromyalgia, like I'm in your corner. Like, hey, here's a doctor out there, and I know I can't take care of in the United States the 10+ million people who have fibromyalgia, but hey, here's somebody, and hey, and if there's a doctor out there who's neutral, who just literally doesn't understand it, but is really wanting to help, hopefully the light will click on and go, oh, that's interesting, and want to take that on, and hopefully they can. But that's where, like, if you have to get it in with a lifestyle approach, somebody's got to work to try to teach them how to eat properly, how to incorporate exercise, and work as a team, And I do recognize when I talk about conquering, there are people who are in terrible circumstances, who are in very high stress situations, in abusive relationships, with a long history of really big struggles, who may be economically in a situation where it's really hard, and there's, even with the perfect medications, there are things that are going to play an impact and have barriers. And this is one where it's not just a pill; it's all of these things. It's not one thing, And in America, we play football. You probably heard of it, or baseball, 2 very American sports. So for Australians, but we have to have 11 players, and maybe you have to explain rugby. We have to do a fun rugby explanation. We occasionally have the championships here, and I'm like, I don't quite get it, but maybe that's the same thing Australians think about football here. But we have like 4 times to get 10 yards. Well, for fibro, and then you have to get a touchdown, which is 100 yards down the field. Well, 4 players have to do, or 11 players have to do everything right just to get maybe a 4-yard gain. And you got to do it right. And if one person doesn't do things right, well, you end up getting sacked and you have to kick it to the other team. That's the same thing with fibro. You have to do everything right every day, all day, and then every week. And if you get something, breaks through, flying to Australia and completely getting jet-lagged and eating junk food, and suddenly it sets off your fibro for a week because you're jet-lagged and, now, and you recognize, okay, we have to try to do the best we can. So there's so many different pieces that have to be played. But if you understand it, then you just have to recognize how that's important. All of those are important.
Yeah, I was just wanting to pedal back a bit or cycle back. You mentioned this hypersensitivity, and I'm thinking there's probably mothers that are listening to the podcast thinking, oh, my son or daughter complains about loud noise or bright lights, and they do complain of a stomach upset or stomach pain every now and then, periodically. Do you recommend that parents, or do you advocate for DNA testing to see if that or do you inquire about a history in terms of a family history to see whether there is fibromyalgia within the family history and whether genetic testing should be done?
So I don't ever recommend any genetic testing because there isn't any marker. There are very few diseases where we do genetic testing. One would be getting a hemochromatosis, for example. There are gene testing that we'll do sometimes. Cystic fibrosis, where they might do some gene testing with that. But there isn't any gene testing, but it's actually just listening and taking a very good history and to recognize. And usually, and I have a chapter in my book on pediatrics and fibromyalgia, and I say, often by the time it culminates, it's into adulthood, and it's been going on for years, but there were regional pain syndromes. I have a chapter that says, your fibromyalgia didn't start likely in adulthood. It probably might have likely started when you were younger, but, I've had patients go, I thought it was normal to have severe pain with my periods. I just always have had that. Until I got older, people go like, no, I don't get 3 days where I'm miserable. But one of the earlier signs, interestingly, on the fibromyalgia spectrum is colic. And I used to explain years ago how I'd say to parents when I'd give talks or explain, I say, colic is basically your baby's hypersensitive. And, you're not doing anything wrong. You can try doing white noise and rocking and different things. Well, now it shows that there's a connection between a history of colic and things like migraines and restless leg syndrome. And often now as a pediatrician, when I have somebody a baby who's got clearly has colic, I'll often then ask the parents, I'm like, okay, I'm just curious, which one of you guys has a history of IBS or migraines or restless leg? And I think it's like 80% of people who have a baby who has colic has some level of restless leg. And so it's interesting conversation. Now, sometimes it's very mild. Maybe they were doing a healthy diet. They got married, and now they don't eat junk food, and they're eating more fruits and vegetables, and they're exercising, so the IBS isn't bad. But often I hear the story like, well, Dad, he kind of gets a bad stomach, or Grandma, and then and Grandma's got fibro. So she probably had these others earlier. So it's very interesting how you can connect the dots and share that, and you have to ask the right questions. So if you know what you're looking for, you then will ask the right questions. And that actually validates, because then as somebody who cares for the parent, one of them might be struggling to some degree as well. What we used to call growing pains in kids, for example. There's two types. One is a growth plate stress. So it's the soccer, rugby runner who's running and jumping, and it's high plyometric exercise, and they're pulling on the growth plate that hasn't fused yet. That's an activity-based pain. But growing pains that are at night, and I can't sleep, and my legs bother me, and waking up through the night is actually what now we understand as restless leg syndrome and periodic limb movement disorder, that puts you at predisposition to developing fibromyalgia and hypersensitivity. Because if you can't get into deep sleep, then you can't get into that good restorative, and your brain, it becomes more hypersensitive to start with, which then they're more tired during the day, which makes them harder to exercise, and you get in this vicious downward spiral. So I hope that answers the question. But it's as I go, I'm talking a lot here, but it's all of these are like dominoes, and they're all interconnected. So that would be one of those, asking more of those questions.
Okay, and it's probably, again, back to that point of why it's typically missed in early consultations with physicians, is because it's multi-factorial, multi-systems, and if the physician sends it to a particular specialist, that specialist may miss it because it's not coming up on the radar as a condition of that system. So I can see how it can be easily missed if you're not got a trained eye like you do for the condition.
And to that point is that when you have a complicated problem, a pediatrician or internist, family practice type doctor, general GP is going to refer it to a specialist. The problem is the specialist only looks at one organ system. The GI doctor only is going to talk about IBS. They're not going to be talking about migraines. They're not going to be talking about the psychiatric component, maybe lifestyle component. The neurologist who might talk about migraines but might not recognize other things. And I use the analogy of the blind man and the elephant. Fibromyalgia patient is an elephant, but they're all looking at one aspect. The spine surgeon may be seeing them for back pain, but they also have painful periods. So you get all these compartmentalization, which is a terrible way to approach fibromyalgia, and that's end up being what the care is. And because I'm somebody who's both specialist in kids and adults with an interest in lifestyle medicine, and I'm able to bring these together, I often hear, and this is just humbly saying this, but I often hear patients after they're seeing me, I call it bittersweet. The sweet part is they're getting better. They have these explanations, this understanding what's going on, but also they're bitter. They're like, Doc, you just saw me one time, and granted, it might be a very long visit, but you were able to put this together. I've been seeing doctors for years, decades, and you figured this out in one visit. Why doesn't everybody know this? and it's like all the stuff we talked about, and that's where, it's one of these where my mom had passed away from pancreatic cancer a year ago, and she always had a big heart, and she always cared for people. She worked as a nurse, and I think part of that carries over to me is like, if I can just care for the little ones, the people who are struggling, the suffering, the poor, the needy, and offering what I can to help them, to stand up for them and care for them. I remember her sharing, giving support for family and friends who were struggling with now what we'd probably call depression. I talk in the book, and this is from the forward, at the end of the forward to the book, is that, picking it up here, is Dr. Young said at the end of the forward, he said, in the years past, depression was often ignored as a real problem until finally the medical community acknowledged that this mood disorder is a valid problem affecting millions and needs to be treated. Now it is time for physicians to step up and realize fibromyalgia is a similarly debilitating medical problem that strongly merits diagnosis and treatment. And Conquering Your Fibromyalgia is an important contribution to bringing both doctors and patients up to speed on this profoundly serious problem today, offering them helpful solutions to their perplexing problem. And that's kind of, you look, and I'm a practicing physician. One of the worries is like, okay, I am very busy. I can't see everybody. And if people hear this, and no, I don't think don't come from Australia to see me. It's too far. But if in the United States, I can't see everybody. And there's no way I can, it's impossible and to do the time. But I'm hoping that just like depression is commonly recognized and understood, and most people now would not dismiss it. But until, probably 30 years ago, it was often dismissed as, why can't you just be happy? Right? Just put a smile on your face, and we laugh at that. And hopefully it'll be a time where like, no, the person's got fibro, their brain works differently. They got a different operating system in how they process things. And you're rude if you say that, and hopefully as the next generation of physicians comes through, they'll have that heart, they'll have that understanding the questions, that they're not just like how we've progressed in understanding medical problems, going from the history of medicine and how we understand things.
It's been a fantastic discussion, Dr. Lenz. I really appreciate you coming on the show. How can the listeners best connect with you?
So if they want to connect with me, you can email me at drmichaellenz@gmail.com. You can go to the podcast, Conquering Your Fibromyalgia, and you can also go to the website, Conquering Your Fibromyalgia. And I love to get feedback. If you've listened to this podcast, you probably have a link on there. I'd love to hear your feedback on stories and just validate. And if you have any other questions that you'd want to ask me, I'd love to have that. Just like as you're trying to do a podcast, trying to get ideas, and I want to serve people who want to learn more. What are the questions on there? Because there's so much. And just in this brief conversation, there's so much more to talk about. Like I mentioned off the air, when you start a podcast, you're like, I don't know, we'll have enough material. And now it's like, oh, I'm getting, I think, enough material. So I hope when you listen, I love listening to podcasts, love listening to your podcast, and learning more is hopefully you'll get a chance to hear somebody who's just caring, who has a big heart, who cares about people. And while you're going for a walk, doing the laundry, cooking a meal, hey, listen for 25 minutes and gain some wisdom, and then share it with others. And actually, this is something where you could share it with your doctor and say, hey, I've had patients of mine say, I'm giving this to my doctor, or I'm going to give this to my sister who lives far, but they're going to read it and give it to their doctor, and hopefully they'll go, oh, well, that's really helpful. That's really interesting, and then want to hopefully apply this to help their patients. So, and
listeners, I'll include Dr. Lenz's email, the links he shared with you in terms of his website and his podcast in the show notes, so you can go directly to the show notes. And yes, I agree with Dr. Lenz. Please give us some feedback, because I'd be happy to have Dr. Lenz on the show, and I've already asked him to come back on the show to speak about other medical conditions, but we certainly would love to have him come back on his topic of passion, and he would love to know, what would you like to know more about? So, yeah, please share the feedback, and we can then set up another episode on fibromyalgia with Dr. Lenz, because he's got so much heart, and that's what I want to conclude on is, absolutely, Dr. Lenz, you are someone that gives, cares, and it's got the biggest heart. And I really appreciate you coming on, devoting your time to really just helping people with this condition, or just, and also today you've been spreading the awareness, getting it out to more people aware of it, that it actually is a condition and that it's often misdiagnosed or overlooked, and that they may know someone that you've mentioned that may have, pretty much all this symptomology or history, and they may then think, well, maybe they've got this condition, and hence they can then connect with you and read your book, or certainly get your support. So thank you once again. I really appreciate it.
You're welcome. Love to be back.
And to the listeners, thanks for tuning in to another insightful episode of Me and My Health Up. Stay tuned in for more coming. So thank you, and I really appreciate you listening in. Bye.
All right.